I'm Darrell Steinberg, founder of the Steinberg Institute. Our institute is focused on making sure all Californians, particularly our most vulnerable, receive quality mental health and substance abuse care. Since I founded the Institute in 2015, we've accomplished so much together, but there's more to do, and we have a big year ahead of us. Thank you to our outstanding board and staff for leading the charge. Here is Steinberg Institute CEO Karen Larson to tell you more about what's on our agenda in 2024.
The California legislative session is underway, and our 2024 priorities are aligned with the key focus areas of Vision 2030. Our Director of Government Affairs, Tara Gamboa-Eastman, and Senior Advocate John Drebinger are here to dig deeper into our 2024 legislative agenda.
Thanks, Karen. More than half of the people in our county jails have behavioral health needs, but most counties spend less than 15% of their criminal justice funding on behavioral health services. At the same time, the way counties keep track of their spending and outcomes is inconsistent and spotty. Our sponsored bill tackles this problem head-on. Authored by Assemblymember Kevin McCarty, this bill calls for more behavioral health stakeholders to be included in the planning process for spending these dollars. We need a more representative set of experts at the table when the budgeting decisions are made to ensure we're spending our dollars wisely. We know that more transparency leads to better government, so we're also calling for better reporting on how this money is spent, including the development of a public dashboard that tracks both dollars and outcomes.
The next bill we are sponsoring aims to hold California counties accountable for improving the behavioral health outcomes of children and youth in our child welfare system. It's called the Child Welfare Behavioral Health Data Integration Act, authored by Assemblymember Gail Pellerin. This bill would leverage existing outcomes data already collected using the Child and Adolescent Needs and Strengths Tool, or CANS, to improve behavioral health outcomes for children and youth involved in child welfare systems statewide. With this information, we can empower state leaders to revamp systems and help youth build resilience and achieve lifelong well-being.
We're also working on reducing unnecessary and traumatic emergency department visits for people in behavioral health crises. Authored by Assemblymember Jesse Gabriel, this bill increases access to behavioral health treatment locations other than ERs, places like crisis stabilization units and sobering centers. Pilots have been incredibly successful in taking people in crisis to these locations and getting them the help that they need. This new approach is critical to the success of our new 988 crisis line and connecting individuals in crisis with the appropriate care. This bill requires the state to analyze what facilities are currently available and ask local governments to develop a plan for transportation to these alternate destinations.
We're also tackling how insurance companies evaluate if they will pay for a patient's substance use care. In the midst of an ongoing opioid crisis, health plans and disability insurers are using untrained personnel to deny care, leaving far too many Californians unable to get the treatment they need and deserve, which can often cost them their lives. Your treatment plan should be decided by behavioral health professionals, not faceless, untrained insurance company employees. Authored by Senator Dave Cortese, SB 999 would establish criteria for health plans and disability insurers that safeguard patient access to timely substance use treatment. This bill builds on existing mental health parity law sponsored by the Steinberg Institute. It will ensure that treatment reviews are conducted by professionals trained in substance use criteria and create accountability and transparency when health plans deny care.
Addressing our behavioral health workforce shortage is critical to achieving our Vision 2030 goals. So this year, we're sponsoring legislation that would improve access to care by giving Californians the opportunity to see psychologists across 40 other states. Authored by Assemblymember Mia Bonta, this bill adds California to an interstate compact that allows psychologists to practice telehealth and temporary in-person psychology across state lines. Keeping residential care facilities open is essential to reducing homelessness for people with serious mental illnesses. Too often, care facilities, also known as boarding cares, aren't able to stay open because they aren't getting adequately reimbursed for the complex care required for folks with serious mental health needs. We're sponsoring legislation authored by Senator Susan Eggman that would ensure these facilities receive the funds they need when caring for people with serious mental illness.
This year, our legislative priorities are guided by our Vision 2030 initiative, This initiative calls for reducing homelessness, incarceration, and hospitalization for Californians with mental health and substance use challenges by half, and ensuring California's behavioral health workforce meets the diverse needs of our state.
It's an exciting time for the Steinberg Institute. We are energized and looking ahead. You'll find the latest information about all our priorities at steinberginstitute.org. And don't forget to sign up for our newsletter for updates. For far too many years, it was hard to get anyone to pay attention to mental health and substance use issues. It's now our time. Let's not waste a single moment. Thank you.